Hello, my name is Akari, and I decided to research and present my topic of public health and national security. So, for the last decade and even the last few years, new events have been presented and have become the forefront of public health and national security concerns. So, starting with what national security is, it is the ability of a nation or country to defend itself and its people from attacks. These attacks can be violent, like forms of terrorism or infiltration, or even bioterrorism. So security controls, national security, excuse me, controls things like the collection and processing of information and maintenance of military, obviously to protect people from kinds of attacks that can happen. So a big example of this would be maybe the creation of TSA after the devastating effects of 9/11. Now, moving into what public health is, it may seem pretty explanatory, but the general definition is that it is the regulation and support of a population's health. So, another example is maybe the suspension of travel for COVID-19 to prevent spread of the infectious disease. So, these public health emergencies are pretty much prime examples of how security and health can complement one another as both kind of attempt to learn, prevent, and correct any kind of happenings like terrorism or bioterrorism. So here are some prime examples that would support national security and public health emergencies. So 9/11, a prominent attack on New York City by an Islamic extremist group, brought severe health effects experienced by survivors like cancer, PTSD, and GERD. So public health programs were made and compensation funds were created. And in turn, we had TSA, which created more security in airports to try to control the flow of illegal items and attacks that could happen. Another happening was the attacks with anthrax in 2001, a week after 9/11. The evolution of hospitals and um, built up protection to try to prevent and have a game plan for health emergencies that people may experience with these were two pretty prime examples of, and unfortunate examples of, security and public health going hand in hand. Of course, COVID-19 is another big one, but we all understand how the pandemic kind of suspended travel, economics, and really saw a big transmission in hurting health for a lot of people. So to conclude, the relationship between public health and national security has pretty much remained consistent in America's history. The tragic events that unfolded are unfortunate examples of this, but have helped in hopefully preventing these events and protecting the people who live in our nation. Are we done? Let's hear it back.